Hello, my name's Heidi Sandoz and I'm a tissue viability nurse. I'm here to talk to you very briefly today about the Society of Tissue Viability's Skincare Champion programme. I am their Skincare Champion educator and I've been in this role for nearly 2 years now. The Society of Tissue Viability is a charity that's over 40 years old and it has a key mission and goal and vision to get education and knowledge and skills around skincare and tissue viability related issues out to as many people as possible. So any money that the society generates is ploughed straight back into meeting that mission. And one of the things they started talking about a few years ago was how difficult it is for people working in social care to access education. And the education that is provided often doesn't include skincare. Now, skincare is a huge topic. It covers the whole body. The skin is the biggest organ in the body. It's the most visible organ in the body. It tells us a lot about what's going on in somebody's body. I just want to tell you a little bit about me. I've been a registered nurse since 1987 and at first I was working on a female orthopaedic ward. The majority of our patients at that time had a fall and sustained a broken hip, a fractured neck of femur. And a fair few of them went on to develop what we called then pressure sores, largely on their bottom, but we now call them pressure ulcers. And I got quite interested after reading an article in the Nursing Times called Are You in the Dark by Dennis Anthony about some of the things he was saying about pressure sores, some of the things he was saying that we shouldn't be doing, and some of the things that he was saying that we should be doing. And we were doing that the wrong way around. And so I approached the ward sister, who was extremely supportive, and she allowed me to go away, expand my research and knowledge on this area, and come back into practice and change practice on the ward, which is exactly what I did. And I then moved around in my career, largely because of what has happened in my personal life, and have taken that opportunity time and time again in different areas that I've worked in, until finally becoming a tissue viability nurse in a hospital setting in 2002. I did my tissue viability degree at the University of Hertfordshire and I qualified with that in 2005. I then did a stint as a lecturer practitioner with them whilst continuing to work in practice in the hospital. And I'm still an honorary lecturer with the University of Hertfordshire today. So my biggest passions really in my nursing career have been about educating others, about expanding their skills, be that in clinical or leadership practice, but also about managing wounds. It's been my biggest interest, and pressure ulcers in particular were a particular interest that grew out of that. So why should you be interested in the Society of Tissue Viability Skincare Champion programme? What will you get for participating in this? Well, I want to remind you that the Society is a charity and that this programme is heavily subsidised by them. The fee that you will pay for a year for your organisation for one champion and one manager to attend is nominal when you consider the amount of hours and educational knowledge and skills that they are going to get from attending it. Why should you be interested? Well, I think that every single person that is in your care will have skin. And some of them, and possibly a large portion of them, will have a skin issue. Now that could be something as minor as a dry skin, or it could be something as severe as a category 4 pressure ulcer. But there are many different types of wounds in between that a person could have. And when I say skin to a lot of you, you probably think of some of the more obvious things like skin tears, like moisture associated skin damage, moisture lesions, incontinence damage, like pressure ulcers. But if you join this program, you will learn about some of the other skin issues that you will and probably have already come across in your time in social care. If you're a manager or you're an owner or a chief exec of a provider of social care, whether that's residential care, whether that's domiciliary care, whether that's nursing home care, then this program might be of interest to you. It runs over a year. I deliver a lot of the training, but when I say that, it means that I coordinate it. I put it together. I provide it for you. It's not me talking all the time. It's not me doing teaching sessions all the time. What I've managed to do is pull a huge amount of resources that are well established, either endorsed or from reputable organisations, and I've pulled them together to provide a programme of learning that is systematic, that starts at the beginning and has an end, that runs over 6 months. We run 6 modules, a module a month for the first 6 months of the year. And then in the last 6 months of the year, I can support with consolidation of that learning. I don't disappear. I can help with any quality improvement projects that you might have started during your first year. We like to call that making things better. I can continue to support learning. I run some expert webinar series where I get national experts from around the United Kingdom to come and deliver a talk just for this champion programme on topics that the champions have expressed an interest in. So why don't you check out the website? Check out the Society of Tissue Viability's website. The address will be up here now, where you can learn more about the Skincare Champion programme and what it can give you, what it can give your organisation, what it can give your carers, and what it can give, most importantly, those that are receiving care from you, your residents, your clients, your patients. We all call people that are in our care different things. But one thing's for sure, as I've already said, they've all got skin, and they will all have a skin issue at some point. I know that each and every single one of you has, in some form or another, had a skin issue. Maybe it was just a blister from wearing some shoes that didn't fit right one day, but nevertheless, you've experienced a skin problem. And what I hope this programme will do will be to upskill those that you select as your champions, help them improve their knowledge and skills so that they can then cascade their knowledge and skills to those that they work with. So I really look forward to seeing you in 2023-2024 for the next cohort of Skincare Champions. This will be our 3rd that we're running now. We run it virtually. It's not possible to do it face-to-face because we're covering all areas of the United Kingdom. But I hope one day we can all get together.